Here's my note cards, front and back. Today I'll be talking to you guys about claustrophobia. A phobia is an anxiety disorder in which a person has an intense and irrational fear of certain objects or situations. One of the most common phobias is claustrophobia, which is the fear of being in a confined or small space. People who suffer from this disorder explain it as being trapped in a tiny space and not having a way out. This anxiety disorder affects between 15 and 37% of people worldwide. The word claustrophobia comes from the Latin word claustrum, meaning shut in place, and phobos, meaning fear. Claustrophobia is usually the result of a traumatic childhood experience that led them to associate small spaces with danger. For example, as a child, if you got lost in a large crowd and separated from your parents, or if you were to climb into a tiny space and you got accidentally stuck there. The mind links the confined and crowded area to danger, and the body reacts how it thinks it should. Claustrophobia could also be learned through classical conditioning, which is when a child observes their parents' behaviors and it develops on them. Some scientists also believe that claustrophobia could be genetically inherited, but right now there's not enough facts or information to be able to prove that. Claustrophobia can be triggered by any small or crowded place. For example, being in public toilet stalls, being in a car, a crowded elevator or a crowded room with no windows, or being in an airplane. Some people have even said that they felt claustrophobic just wearing tight clothing. People with claustrophobia will go great lengths to avoid any of these situations. For example, instead of taking an elevator, they will take the stairs, no matter how long it may take them or how many cases of stairs there may be. Or instead of being in a car, they may walk someplace, or they'll wait until really late at night to leave their home so they don't have to come in contact with people or drive in heavy traffic. A symptom that most claustrophobic people have is they will compulsively check for all of the exits and all of the windows and position themselves near an exit just in case they have to leave. A closed door may cause a person to actually have a panic attack. Since claustrophobia is an anxiety disorder, a person with the disorder is most likely to have similar symptoms as a panic attack, which are sweating, hyperventilation, rapid heartbeat, lightheadedness, shaking, nausea, or the actual feeling of being ill and being harmed. Claustrophobia could be diagnosed by your family doctor or a psychiatrist. They will ask you a series of questions and do a physical exam. Diagnosis and strength of treatment is based upon your history of excessive and persistent fear that is triggered by an anticipated event, or if it causes frequent panic attacks, or if it interferes with your daily life. Sometimes there just may be no other explanation for your behaviors. Peter Watts once said, "But then I remembered, the universe was closed and so very small, there was really nowhere else to go." People with claustrophobia cannot control their irrational fears, they have no choice, and they can't run away. Without treatment, they are trapped with it. The thought of treatment for a person with claustrophobia can be very frightening because most treatment methods deal with actually confronting their fear face to face. This is also known as flooding. If the patient is too scared to do flooding, then they could also choose counter conditioning, which is taking baby steps towards actually confronting their fear. If this is still too much, they could choose modeling, which is when they watch another person with claustrophobia confront their fear. This could show them that it'll be okay and there's nothing to fear. Other options may be using visualization and relaxation techniques to calm their fears when in a claustrophobic environment. The last option before medication is cognitive behavioral therapy, which is learning to control the thoughts that occur when confronted with their fear. Medications that are used to treat claustrophobia are tranquilizers and antidepressants. With treatment and a positive attitude and support from their family and friends, it is completely possible to overcome claustrophobia. The 3 sources I used were Medical News Today, New York University website, and BetterHealth.gov. Thanks for listening, and I'd be happy to answer any questions that you guys might have.